Because for today, I will be performing the abdomen assessment. Today, I will be performing the abdomen assessment. Is it okay with you?
Yes.
Okay, so I have questions for you. Do you take any medication?
No.
Do you have allergies?
No.
Have you experienced incidents or accidents or surgery?
No.
Do you feel pain or discomfort?
No.
Um, does anybody in your family has history of, for example, gastroenteritis, ulcer, or appendicitis?
No.
Okay.
We will perform the inspection. First, observe general appearance of the patient lying. Inspect surface, color, contours, or movement in abdomen. Inspect also the temperature and notice if there is scars, jaundice, stray, or dilated veins, and take note of it. We will perform the auscultation of abdomen. We will auscultate for bowel sounds, vascular sounds, and peritoneal friction with. In order for us to assess the bowel sounds, we must locate our stethoscope in the 4 quadrants. Listen for active bowel sounds. The normal consists of clicks and gurgle. It is 5 to 34 per minute. We will also auscultate the aorta, renal arteries, iliac arteries, and the femoral. We will use the bell of our stethoscope. The aorta is located above the umbilicus, and the renal arteries is beside it. The iliac arteries is located beside the umbilicus, and the femoral is located below the umbilicus. We will also auscultate the peritoneal friction. High pitch can be heard in liver and spleen. Listen for hepatic friction rub in the liver and listen for splenic friction rub in the spleen. We will also auscultate the splenic site. Place our stethoscope in the left lower rib cage in the anterior axillary line. Observe for friction rub. We will perform the percussion to help assess the amount and distribution of gas in the abdomen. We will percuss lightly in 4 quadrants to determine tympany and dullness. Next we will percuss to determine the size of the liver. We will begin at the right midclavicular line below umbilicus and percuss upward over tympanic areas until a dull percussion indicates. Mark for it. Then percuss downward until dull percussion or sound indicate and measure it. We will just repeat the steps and we will percuss also at mid-sternal line. After you determine the upper and lower border, measure it. The normal is 4 to 8 cm at the mid-sternal line and 6 to 12 at the mid-clavicular line. We will now proceed to the palpation for us to detect if there is abdominal tenderness or muscular resistance. We will perform light palpation in the 4 quadrants. Warm hands should be observed. We will also perform deep palpation in the 4 quadrants and note areas of tenderness, pain, or masses. Ask your patient to deep breathe and observe the facial expression of your patient. If it's normal, there is tenderness in C4.